I chose to come to Mayo Clinic for residency because I got to be here as a student and I saw the most honest, genuine version of the program. And I was so impressed, not just by how warm and nice everyone was, but the preceptors were just exceptional. I felt like I learned so much in just a short period that I was here. I got to round with the actual teams and meet the consultants, and so I got to feel how important pharmacy was here and how well respected we were. And that's huge.
Mayo Clinic has a proud tradition of pharmacy residencies. Our first program started in 1972. 5 decades later, we have nearly 20 programs across Rochester, Arizona, Florida, as well as our 3 health system sites in La Crosse, Mankato, and Eau Claire.
So the 3 shields of Mayo Clinic, in terms of how they've made me successful, I think about the program as a whole and how it is modeled after those shields. So everything we do as residents falls within, I would say, one of those umbrella themes or visions or goals of Mayo Clinic.
The 3 shields here at Mayo are really something that all the clinicians live by every day. It's not just something we put on postcards and, on our websites. It's something we really live.
So if you're a pharmacy resident at Mayo Clinic or Mayo Clinic Health System, you can expect to get the complete package as an educator, as a researcher, and also as a clinician.
What it's like to be a learner at Mayo Clinic, I would say it's like being part of a larger family, per se. It's a very inclusive community in which I would say most everyone you interact with, pharmacists, even physicians, they're interested in you and interested in learning about you even outside of the clinical setting.
Mayo Clinic has been great at educating pharmacy and medical residents side by side over the past few decades. So I would say that practicing with medical residents, they have been taught how to rely on pharmacy and be collaborative with pharmacy, and that really elevates our practice as pharmacists because we're expected to be at the bedside, make contributions on rounds, and really just contribute to progressive patient care.
As an organization and a department of pharmacy, we work together, and sharing curriculum is one of those ideas. For example, our research curriculum for residents was designed about 15 years ago. We noticed that there were a handful of residency programs that were educating their residents on how to do research. And so we took a step back and realized that all programs would benefit from that resource. What we did is we had sessions initially on database design and poster development and abstract development. And now, 15 years later, we've created a curriculum that all residents across all Mayo Clinic and Mayo Clinic Health System sites use to advance the practice through research education.
It's just incredible how much you learn in a year, and they set you up with the right people and the right resources, and you really get to do groundbreaking, important research here.
I would say my favorite part about being a learner here or having spent 2 years here training was the support system that's in place for residents. I think it's an understated part of this program or the programs that Mayo Clinic has. And that starts with program leadership, preceptors, mentors that you work on for projects or otherwise, and even your co-residents, just the people that Mayo Clinic attracts. There's definitely a structure here that's put in place for you to be successful as a resident. And as long as you come here willing to put in the time and the energy to be successful, there's going to be people that are willing to work alongside you.
The first day of residency, you feel every emotion under the sun. You're excited to meet all of your new co-residents that you'll be really close with over the next year. You're also nervous because this is your first official day as a licensed pharmacist. And then you also are just ready and excited to tackle every single kind of challenge that comes your way and just ready to grow as a growing clinician.
My decision to come here for my training dates back to the first steps I took on Mayo Clinic campus when I came here for my interview. There was something about this place that was different than the other places that I had toured and other places I'd interviewed and people I'd met at those other institutions where I could tell from the moment I walked in that these people were invested in me and I wasn't even a trainee here yet. They were as invested in me as a potential trainee as I was in trying to pursue my next phase of training here. So I could just tell this place had kind of the it factor. It had the culture that I wanted to be a part of, a supportive, encouraging, lift you up kind of culture that I wanted and I knew would be required for me to be successful as a resident.
My favorite aspect of the residency program, I think, has just been the people, honestly. Apart from all the standard residency things of learning and clinical rotations, which there's a ton of, I think that I've been really overwhelmed by how amazing everybody is here. Not just my co-residents, but also the preceptors who really invest a lot of time in you, really want to see you succeed, not just as a resident, but in your career overall. And our directors who are just so passionate about pharmacy and about teaching learners. It's really been the most rewarding year, I think, of my life, not just in how much I've grown, but in how many relationships I've been able to make.
I've had multiple instances where consultants have come up to me during rounds and they're wanting to know who I am. Who are you? Where'd you come from? What's your story? What's your path? You know, what brought you here, kind of a thing. And so I think that really just shows how everyone is invested in you both as a professional and as a person. And it's the diversity of everyone's paths that makes this place super unique.
The biggest thing that really makes Mayo stand out from other programs is that we don't just build exceptional pharmacists, we build leaders. And I think that's a really big part of this program that not a lot of other hospitals can say.